Now coming to antenatal history, contact history gone, antenatal history. Antenatal history, it is very significant. What all happened when the child was intrauterine, that is affecting the when the child is away from mother, right? So in the antenatal history, what do we ask first? We ask first whether it is a booked case or not. Booked, what do you mean by booked case? Whether the case is registered or not. Where the cases will be registered? In the Anganwadi centers, right? So how do we extract that thing? Not everyone will understand it. So you ask, did you get eggs and sattu from Anganwadi? They'll relate with it, right? So that from that we get to confirm that it is a booked case. So first, booked case or not. Age, weight, height of mother. Age we can know, weight and height if possible, if measured, well and good, because short stature can lead to complications in a child. A lean and thin mother, a malnutrited mother gives birth to a malnutrited child, right? So next we come to immunization status of mother. Whether 2 doses of TT are taken or not, whether any vaccination, any other vaccination other than TT is taken during the pregnancy period. Gravida, parity, abortions, whether any previous abortions, which order baby is this, how many of them have crossed the period of parity, any complications. During pregnancy, right? I'll coming to the complications. Ask trimester wise. First trimester, whether the mother was well, whether ultrasound was done or not, how many antenatal visits were done, whether the mother had any disease like fever with rash, multiple episodes of vomiting, headache, convulsion, then those all come in complication. Fever with rash, increased frequency of micturition, UTI, then headache, there may be pregnancy induced hypertension, convulsion, any drug intake, in fever with rash we rule out one particular thing, that is torch infection. We have seen lots of cases coming in which mother is torch positive. What is torch? Toxoplasma, rubella, cytomegalovirus, herpes simplex. O is other agents. So toxo, rubella, CMV, herpes simplex virus, right? So these things we ask in antenatal history. I'm making a separate playlist on maternal diseases, maternal lifestyle and maternal drugs on child. I won't insert it here because you will get deviated from history taking. Now, so antenatal history clear, we will ask it trimester wise, number of ultrasounds, any complications, any additional drugs taken during any trimester, whether the mother was gaining weight, whether the mother was able to feel the baby movements in appropriate trimester, whether the mother was able to feel the quickening, the baby descent down. So all these things trimester wise we need to ask, right? Now comes natal history or birth history. Natal or birth history. What is that? In this, what do we write first? Order. Which order child is this? Remember, when you ask which number child is this, if the first child is dead, mother will say this is the first child. Mother will not consider the dead child as a child, you know. So, but that's very significant. If there is a previous sibling death, that is very significant for us, but mother will not say. So ask them whether there was any death. So it's our job to extract that, right? So order. Then what is the mode of delivery? Whether it was a normal delivery or a cesarean section. Place. Whether it was a delivery conducted in the hospital or home. It's better to say domiciliary delivery than home delivery. It's a baby, not a pizza. Then term or preterm or post-term. Less than 37 weeks, 37 to 42 weeks, more than 42 weeks. Less than 37 weeks preterm, 37 to 42 weeks term, more than 42 weeks post-term. Then what was the weight of the baby? Then did the baby cry immediately after birth? There is a disease called hypoxic ischemic encephalopathy, which is very common in our setup, in which the baby does not cry at birth. When the baby grows on, the baby might have convulsion in the neonatal or infant period. When the baby becomes older, grows on, there is static, the brain development stops at a point. That is, the other form is called cerebral palsy. So we have to rule out HIE while taking history in each and every baby, right? So how do we rule out it? Simply by asking whether the baby cried immediately after birth or not. This completes your natal history or birth history. Now we come to postnatal history. Postnatal history, if any, we would write. If there is no postnatal history, we need not write. What postnatal history can be there? After birth, whether you will ask simply after birth whether the child stayed with the mother, or was admitted to any SNCU or ICU. SNCU means special newborn care unit, or neonatal ICU and ICU for any reason. What might be the reason? NNH, neonatal hyperbilirubinemia, or what we say jaundice, neonatal jaundice. Second, feeding difficulty. Third, lethargy. It can be anything, Fourth, convulsion. If you ask it, mother will tell it. Mother might not say from her side, but if we ask it, if there is a history of hospitalization even for 1 or 2 days, mother will say it. This completes your postnatal history. If there is a history of hospitalization, ask what was the duration of hospitalization, whether any medication was given, because if the patient postnatally was admitted for a case of convulsion, there must be some postnatal, from post discharge medication. After the discharge, some oral medication, some anti-epileptic drugs might have been given, which may be significant in our history, in our disease. Okay, so now we come to developmental history. Developmental history. Here we ask whether the child has attained all the milestones at a proper and appropriate age or not. What all milestones? Gross motor, fine motor, language, and social. There is a detailed list which I will be providing. It's also in our guidebook. There is a detailed list at which age the child is expected to attain what milestone. The let's say neck holding by 3 to 4 months, it is a range, it is not a particular age, right? If the mother says that neck holding attained by 4 to 5 months, it's all right. If the mother says that neck holding by 1 year, it's not good, it's not all right, right? So gross motor, fine motor, language and social. So if you don't remember everything, just remember the basic ones like neck holding, social smile, standing, sitting, with and without support, mono and bisyllable. Just take these histories. Let's say if the mother says that sir, my child is 3 years old and has not attained neck holding till now, we do not need to ask after that, because the first thing is not attained. So it's completely sure that the other things would not have been attained. This completes the developmental history. Now we come to nutritional history. Nutritional, right? In nutritional history, we start taking history right from birth till today. Let's say the child is 7 years old, right? 7-year-old. So first we start, when was the child breastfed for the first time? I mean, within how quickly the child started breastfeeding, we mean that. So how do we ask mother, when was the child shifted to you? In case of normal vaginal delivery, we start as soon as possible. In case of LSCS, we can start within 1 hour or effectively within 4 hours. So how quickly the baby started on breastfeeding? So exclusive breastfeeding. How long did the exclusive breastfeeding continue? The mother will say, sir, I exclusively breastfed my baby for 2 months, after which there was no sufficient milk, so I started on formula feeding or prelactal feeding. So till 2 months, then formula feeding, from 2 months, right? When you ask a history about formula feeding, always ask bottle feeding is there or not. Was the child on bottle feeding? Was the child on any other feed other than milk and formula, like water, cow milk, honey, buffalo milk, all that? What was the proportion of the formula? 30 ml, 1 scoop, or anything else other than that? Gone. Nutritional history. Then from 6 months we need to start complementary feeding. So when was the complementary feeding started? When was complementary feeding started? What did it contain? Usually complementary feeding consists of homemade semi-solid food, right? That is usually started after 6 months of age. What was the content? Then we ask, now what is the child consuming now? So how do we say it in a sentence? Sir, the child was exclusively breastfed till 2 months of age, after which the child was on formula feeding. Complementary feeding started at 6 months of age, that contained homemade semi-solid diet, and now the child is on mixed Indian food from the common family pot. We say it like this in a sentence: now on mixed Indian food from the common family pot, right? After we take all these history right from birth till today, we take a 24-hour diet recall method. What is that? We ask, now the child is in the hospital. When the child, if the child would have been at home by now, or when you came to the hospital today, yesterday, in the last 24 hours, what was the child's common intake? What do we do with that? There is a chart in which all the foods are listed, all the quantity and the calories are listed. We calculate that and we estimate the amount of calorie and protein that the child that is needed for the child, desired, and the child is getting. So we calculate whether the child is on a calorie deficit or not. We calculate whether the child is going towards malnutrition, whether the child is going towards obesity. We calculate all that in a 24-hour diet recall method. Right. Now we come to immunization history. Simple. You ask whether the child is immunized as per NIS. What is NIS? National Immunization Schedule. Birth dose vaccine was taken or not? Right. BCG scar. Where do we give BCG? Left deltoid. BCG scar is present or not? Any optional vaccines taken? Any optional vaccines taken? What are the optional vaccines? The children who are usually immunocompromised. Some optional vaccines that are not listed in the National Immunization Schedule are recommended for those children, like meningococcal, like typhoid, like hepatitis A, like influenza. If they can afford, they can give their children and make them immunocompetent. So these all we ask in immunization history. Now we come to personal history. So what do we ask in personal history? Personal history is usually asked to a child who is above 7 years old, so that the child has an idea what he or she is doing, or the parents have an idea what the child is doing. So first we ask about the personality of the child, whether the child is getting angry, too much angry, whether the child is a calm personality, whether the child is getting very easily distracted, whether the child is getting a lot of screen time. All those things we ask. Second, the bowel bladder habit, academic performance, of the child, right? Now we come to family history. What do we ask in family history? First, very important, family history we get a most of the time in the if we ask this particular question in family history, we get a brief idea about the disease of the patient. That what is that? Consanguinity. Whether the how do you ask consanguinity? You ask in their language, in the patient's, in the attendant's local language, that whether the marriage was in the family, whether they were knowing each other before marriage, whether they are related by blood, whether they were distant relatives. So like this we extract the history of consanguinity. History of consanguinity is very important in cases where the disease progression is genetic, like sickle cell anemia, like thalassemia, like all those, hemophilia. Second, age of the parents. Matter elderly mother, when as the mother's age increases, the incidence of Down syndrome, the chances of giving birth to a Down phenotype baby also increases. Any significant illness, significant illness in family. What significant illness are we looking for? Sickle cell anemia or thalassemia, epilepsy, allergy, eczema, any chronic diseases like chronic kidney disease or chronic liver disease, right? So these all we can ask importantly in family history. Last we come to socioeconomic status. In socioeconomic status you ask the overall status of the family. How is that important? That is very important in the sense that an educated family is less vulnerable to preventable diseases. So we ask, what do we ask first? Housing. Whether they live in a pakka house or a kacha house. What are the number of rooms? Number of members. Why number of members? To see if there is any overcrowding. Which diseases are very prevalent in overcrowding situations? Respiratory illnesses. Whether there are windows in every room. Why are we asking this? To know about the ventilation status of the room. Now after housing we come to water. Which water the family is using, whether it's a public tap, it's a private tap, it's a well or anything, it's a pond, anything. Water for drinking and cleaning purposes, right? Then whether the family is using a toilet or practicing open defecation. You can ask it. Some people might have a toilet but still उन्हें खेतों में जाना अच्छा लगता है. Last but not the least, we go for the Kuppuswamy scale. What is that Kuppuswamy scale? It's a scale that gives us an idea where the family is staged, whether it's a lower status, lower middle or high socioeconomic status family. So what all components are there? Education, occupation of the head of the family, one, two. Third, income. Income is not for the head of the family. Income is of the family. Here we make a common mistake. We ask the income of the head of the family, but there might be mother doing some stitching business and getting some money to the family. So we take the income of the entire family, right? So this completes your socioeconomic status and your overall history taking. So this is all about the history taking. What did we learn in brief? So first we do the patient details, chief complaint, history of present illness, history of past illness, right? Always write like this, so that you can process them in your mind. Treatment history, contact history, right? I have completed almost everything. Antenatal, natal, postnatal, developmental, immunization, nutritional, personal, family, and socio-economic status. You do this, go through the video. If any doubt, ask in the comment section. If any clarification needed, ask in the comment section. You are always welcome. We are coming with more content in the further videos.